Thanks everyone for joining today. My name is Beck G. Cohen, and this is the Visions Lunch Stop CEU series. Just a little bit about Visions is that we're an adolescent treatment program here in Los Angeles, California. Our programs include mental health residential, dual diagnosis residential, extended care, PHP, IOP, Visions Day School for young people ages 12 to 18. And we also recently opened a Visions specialty clinic with therapists specializing in OCD, eating disorders, trauma, gender and sexuality, and much more. You can reach out to me with any questions about our program. I'm sure you've gotten plenty of emails from me over the last couple of days. Just some general housekeeping is that you must be present for the full hour to receive CEUs. You'll get an email after this, which will send you to a Google form to fill out, and then we'll send you your certificate. And let's see what else. If you have any questions for our presenter, he's going to be answering questions at the end of the webinar. So feel free to put it in the Q&A portion, which is at the bottom. It says Q&A. And then if you have anything, technical difficulties, anything like that, feel free to go to the chat button, and then I'll chat with you via that. And I think that's it, except I'm going to introduce you now. So this is Miles Marcotte. Miles is a trans therapist with lived experience who specializes in LGBTQIA plus people, trauma survivors, people with chronic illness, and members of the kink BDSM community, and poly community and sex worker communities. Miles currently offers telehealth services to people of all ages, as well as couples and polycules at Prospect Therapy in Long Beach, California. And I think we met in like Palm Springs a couple years back. Yeah. At a
addiction conference.
Yeah. So yeah. I'm just so grateful. I follow you on Instagram, and you always have really amazing things to say. And I'm just excited that where you're working. And now I'm going to leave it to you. So thank you for being here.
Thank you so much for that introduction, Beck. Oh, I'm looking at myself. Let me close that. All right, great. Hi, welcome everybody. As you know now, I'm Miles Marcotte, and I am a therapist at Prospect Therapy in Long Beach. And I before I start into all of this, just want to take a second to really just express my gratitude for everyone being here. This is a big, complex, heavy topic, and I'm so blown away that so many people want to take a break in the middle of their day to sit with this really heavy topic. I think it's really important that we have more providers who have a more nuanced understanding of these issues. So I'm just, it just means a lot to me that you're here. And I am one person, these are my thoughts and views on this, but I hope that this is more of a discussion opener than a be all and end all of anything. So yeah, let's dive in a little bit. So this workshop is called Normalizing Complex Grief and Transition, and I'm going to be talking about how do we support trans and non-binary clients who are dealing with difficult, painful, unexpected, mixed emotions that might come up in relation to gender-affirming medical procedures. Here we go. So you already kind of got an introduction to me. All of this contact information will also be in the last slide. So if you want a copy of the PowerPoint, just let me know. I don't want you to have to screenshot everything the whole way through. And there's a lot of information on here that I'm going to try and get through all of it. But please feel free to reach out afterwards if you want that. So a couple of disclaimers before we get into this. One is just about the audience for this. So I designed this with with clinicians in mind. So it might be like a little technical at some points. And I also, this is very much not a trans 101. So what that means is that I just would really encourage you as you're listening to this to kind of check in with yourself about where you are around your own knowledge of trans issues. And if you find that there's a lot of things that are just flying over your head, to just encourage you to seek out more resources, more education. I'm not going to be going over basic concepts and language in this. So So that might come up as you're listening to it. But speaking of language, I am going to use a little bit of shorthand here because I only have an hour. So if you're hearing me saying transition, really the preferred term would be gender-affirming medical procedures. But if I said that every single time, this would be a 3-hour workshop. And I'll be using trans as shorthand, for sort of the entire umbrella. So people who are questioning, non-binary, transgender, transsexual, all within that realm. And in terms of the population we're talking about, I just want to be really clear that not all trans people physically transition or even think about physically transitioning. This workshop does focus on people who are considering that or who have experienced that, but it is not something that is even on the minds of all trans people. So I just want to be really clear about that as we go into this. So I'm going to be breaking this into 3 sections. We're going to talk about narratives of regret and how they impact our trans clients and how they impact our trans clients, how they impact our ability to have complex emotional expressions. And that part is going to seem a little tangential, but I promise it's really foundational to the rest of what we're talking about. We're going to go over some examples, some sort of case examples of what might it look like for that complex emotion to come up in transition. And then at the end, we're going to get to the real juicy stuff, which is probably why most of you are here, which is like, what are the approaches? How can we support our clients in experiencing these things and navigating them? So starting with these narratives of regret, these are narratives that are part of the culture and also narratives that seep into the imagination of providers and family members and trans people. And they create an environment where for trans people to talk openly about mixed emotions, about grief and fear and doubt and all the things that can come up in this process becomes really risky, because to do so means that you might be seen as reinforcing those narratives. It means that your story might be stolen from you and used as evidence for those narratives. It means that it might be used to deny you access to care. For me, as an adult who has been, engaged in transition for a long time and who is independent and autonomous, it's even scary for me in this context to talk about these things, because I know how easily my words can be kind of taken out of context and applied in a way that hurts trans people. But I think it's really important to talk about these things, because I think when we don't, trans people suffer alone. And that's what I don't want to have happening. So I'm going to go over 2 narratives, and then we're going to go over sort of an illustration of how they seep into the community of LGBTQ affirming providers. And then we're going to kind of break these narratives down too and look at, okay, so what if these narratives were true? How would we deal with it then? So this first narrative that we're starting with is a narrative of trans regret. So the belief here is that there are lots of people who are sort of fooled into thinking that they're trans, who then engage in physical transition and then later realize that that was not right for them, and they regret it and they suffer terribly because of it. And this is more of an older narrative. You're more likely to see it among like trans conversion therapists and more among conservatives. But it does seep into even our LGBTQ affirming provider communities. And both of these narratives that I'm going to talk to you about have a really serious lack of evidence, and what little research exists is very heavily contested. I'll talk about that a little more, but I didn't add citations for those in here, but if you want more reading on it, feel free to email me and I can share some of those things with you. The second narrative I want to talk about is what's called rapid onset gender dysphoria. So the belief here is that there are lots of, especially youth, especially female assigned at birth youth, who are becoming dysphoric sort of all of a sudden out of nowhere. That the reason for this is because they've been exposed to trans media or they've met trans people. And that in these cases, if you delay access to care, dysphoria will go away. This is a newer narrative. It's coming mainly out of mainly out of one study from like 2018 or 2019 that sort of coined that term, rapid onset gender dysphoria. And yeah, the evidence is lacking and the research is really kind of remarkably terrible. If you actually go look at it, that particular study, their sampling was surveying parents who were posting on anti-trans websites as representative of this overall experience. We'll go into that more, but suffice to say, there are a lot of problems with this narrative, and it is also one that comes into our communities. So what I want to share right now is just a little story that I think illustrates how these things seep into our communities. I recently heard a story from a person who is both a clinician and a parent, and their teen came to them and said, look, I'm really struggling right now with my dysphoria. It's really affecting my mental health. And I want to talk about accessing, hormone blockers, hormones. I want to talk about transitioning. And this parent had this really intense, conflicting reaction. And she shared that she felt like, on the one hand, she had been working as a queer affirming provider for years and years, and she sort of knew what the things she was supposed to do were. And on the other hand, she was really scared about her child. She was scared her child was going to make a decision that they would regret. And so she decided to kind of approach it like a clinician. She was like, okay, I'm going to look at the research. I'm going to see what does the evidence actually say about how effective or safe these interventions are for youth and what the long-term outcomes are. And she saw all of the stacks and stacks and stacks of research showing that these interventions are largely really effective and really increase positive outcomes. But she kept looking, and finally she found that little study on rapid onset gender dysphoria. And she read it, and it confirmed all of her fears. She felt like, oh my gosh, this is my child. My child's dysphoria came out of nowhere. I'm going to follow these suggestions. I'm going to delay access to care and see what happens. And so she did. And she pushed it off, and she pushed it off, and she pushed it off. And her child's mental health got worse and worse. And her child kept fighting for access to these hormones, to blockers. And eventually mom reached her breaking point and was like, look, I don't know what else to do, so I'm giving you permission to transition. And her teen took that permission and sat with it and came back and said, I'm not actually sure that I'm ready for this. And for me, when I heard that story, I was like, wow, what a great example of how when we hold on so tightly to that fear of regret, when we hold the doors to the gate closed so tightly, we create this scenario where people are forced into a fight mode. People are forced into a mode where any kind of uncertainty becomes a threatening emotion, and there's no room for you to process your own fears, your own doubts, your own certainties, because it might mean that then you don't get access to care. So for me, I was like, this is a great illustration of the ways that gatekeeping and delaying access to care sort of have the opposite effect by taking away our space to be able to have complex emotions. Unfortunately, that was not that mom's interpretation. Her interpretation was, I delayed access to care and it worked. So rapid onset gender dysphoria is real. And that conclusion she shared in a speech at a national conference for LGBTQ affirming providers, and it was met with a standing ovation. The reason I share that is because I think it's really easy to see these narratives as something that kind of exists at the periphery, something that, oh, I wouldn't do that or think that way as an affirming provider. But it is something that comes up for affirming providers. And I want to honor that, it often is not coming from an anti-trans place. It often is coming from a place of wanting to protect people and having a fear of people making decisions they might regret, which is why I think it's important to go into actually breaking down these narratives a little bit, looking at rapid onset gender dysphoria, there are a lot of assumptions that are underlying that narrative. And one of those is that family members are reliable reporters of when dysphoria appears, which is just not the case. Dysphoria is an internal experience. It's a really individual experience. And not only is it something that people, sometimes suppress and don't realize is what is going on with them, but even if they know that that's what's going on with them, there are a lot of incentives to hide that from your family. And if you're depending on your family seeing dysphoria as you were a gender nonconforming child, that's based on the assumption that all trans youth appear gender nonconforming. I, for example, am a trans man, and I was a very feminine child. And I would not have met criteria for gender dysphoria and DSM when I was a kid. I know plenty of gay cis men who were feminine children who would have met that criteria. So part of the problem is that our gatekeeping, that we think if we make the gate stronger, we'll filter cis people out, don't actually filter cis people out. They filter trans people out. And that's a problem. The other part that I think is important to understand is that dysphoria is not static. This narrative of rapid onset gender dysphoria relies on the belief that if someone's dysphoria spikes and comes back down, that means that both before and after there was no dysphoria and there will be no dysphoria, that was an anomaly. But I would challenge that to say that really dysphoria is a dynamic thing that fluctuates throughout our lives. You can have dysphoria that is much worse, one day and much better the next day. That can fluctuate from hour to hour. People suppress dysphoria for decades as a survival mechanism. There are so many ways in which dysphoria can fluctuate and is dynamic. So I think it's important to understand that for dysphoria to be something that is persistent and that affects someone's life doesn't mean that it has to have been consistently the same throughout their life. The other thing I want to challenge about this trans regret narrative is thinking about, why is it that the story that we're told is that if someone physically transitions and realizes that it's not right for them, that automatically means that that's a situation of regret, and that regret automatically means suffering. So what I mean is, I've been in this community for 15 years. I've been out as trans for 15 years. I've met a lot of people, and I absolutely have met people who have physically transitioned and then later transitioned again, or later realized that their identity was different, or any number of things. None of those people that I have known have experienced that as an experience of deep, permanent suffering and regret, but instead as part of their experience of their gender journey, something that enriches their experience of their gender and their view of gender in the world. And I think the other important part of this is to understand, even if I get to this place where I'm saying, okay, let's say this is a phenomenon that's happening. We know it's not happening on a large scale, but let's say it is happening sometimes, and let's say it matters, And also, so what? Let's look at, is it worth changing that gatekeeping to such a degree to prevent these potential scenarios of regret if the result is that we're risking the lives of trans people who are suffering from suicidality, suffering in their mental health from this delayed access to care? We don't have evidence that there is an epidemic of cis people regretting transitioning and suffering terribly. We do have evidence of an epidemic of trans suicide and suffering. So I feel like it's important to kind of challenge that idea. So what I'm really trying to bring to the table with all of that as we move into the next section, and thank you for bearing with me for all of that, is the question is, without gatekeeping, without the sort of natural solution to these fears of regret, what can we actually do to make room for the thing that all of us really want, which is for everyone to have the space to be able to reflect on their gender, on their dysphoria, on their decisions about transition? How do we actually create the space for that? And I'm saying it's not by closing the doors on people, it's by opening the doors and creating a space that is safe to have those conversations. So before we get into sort of how we do that, looking at the approaches, I'm going to give us some examples of scenarios in which these complex mixed emotions might come up. Because I think it's important as providers that you have a frame of reference for what you might possibly expect. And I also just want to pause. I know that I'm just moving on to the next thing, and I just probably said a lot of things that might, bring up a lot of emotional reactions, or might be a lot, coming up in thinking about challenging those narratives. And I just want to, say that I'm grateful that you're sticking and staying here with that, and also that there's room for Q&A at the end. So please feel free to put your thoughts in the Q&A, and we'll get to it and talk about it. So let's talk about these scenarios. So like what can come up? What are some of the feelings that can show up for people who are struggling with this situation? And I want to be clear as I go through these examples that this is not a list of like reasons not to transition. This is a list of things to prepare for, things that might come up. And that would be true for anything. That would be true if you were going away to college, or if you were moving to a new city, anything that's a big positive change. There are a lot of potential things that can come up. So starting with things that might come up when you are in kind of a contemplative stage, when you're considering transitioning. I'm not going to read all of these. I could write 100 of them, but I just want to, get at a couple of the examples. So one example would be that you find yourself wishing that there was more of an in-between option. You find yourself wishing that there was, a switch you could flip on the wall that would change your sex characteristics from one day to another. You might find that like as you start to acknowledge the possibility of transitioning, that your dysphoria gets worse, that this thing that you'd kind of put away in a corner in a box that you could suppress and ignore and deny, all of a sudden is right up in your face, and it's really hard. Another thing is like anticipatory grief about losing or changing body parts, especially if those are body parts that even if you hate them, you have some attachment to them. Maybe that's because they were part of your body, as you were surviving traumas. It can be because those body parts give you some kind of social or sexual capital. Maybe it's a body part that you use in sex work. Maybe it's a body part that lets you feel like you have sexual power in certain situations. And maybe that's the only power that you feel like you have in the world. And that can make letting go of those things, even if they're causing you to suffer, really scary. Another thing that can come up is just anxiety about privileges that might change. There's a lot of intersections with race and class and all of these things where as you transition, you might be sort of making an active choice to move into a space where you are not as safe, or where you are not as privileged, or where you might experience more harassment, discrimination, all these kinds of things. And that's a really hard thing to like step forward into. There's a lot more here, but one more that I'll just say is struggling to reconcile sort of body acceptance with dysphoria. And that might be because of, religious faith that teaches you that, your body, is perfect the way that it is. And it might be because of the body positivity movement. It might be because of your gender politics, any number of things, but it's a really hard dissonance to hold, a hard thing to reconcile. Let's look at examples that might come up as you start to physically transition. One of the things that I see come up a lot is as folks, as like your scent and your features and things start to change, that you might find that you start to remind yourself of someone that you really don't want to think about. That could be a past abuser in your family. It could be, a loved one that in your family that you are grieving who has died. It could be that the way that you smell reminds your partner of their abuser, any number of things. And it can be really triggering around trauma issues. Another thing that can come up is just that like there are changes that you weren't warned about. Like there's so many aspects to transition, and it's hard to properly prepare anyone for all of the things that can happen. There's also even if you're not expecting that transition is going to solve all your problems, if you are someone who's dealt with trauma or mental health issues, there might be a hope that like, okay, once I transition, these things are going to be better. They're going to be so much easier to deal with. And you might get to the other side of that and be happy that you transitioned and still feel like, crap, all of this stuff is still here and it's still hard. Um, and that can be, really difficult. And the last one that I'll say is just like, as you start to experience that other people are perceiving your gender differently, it can make you really hyper vigilant about like, am I passing now? Am I passing now? How are people reading me here? How are people reading me in this environment? Which can really exaggerate like any anxiety or paranoia that is already there for you. So all of these things, again, are things where like you can be perfectly happy in your transition and still be experiencing all of these things. Another sort of area where these things come up is after a major change. So after something like surgery. Something I see a lot is what like I like to call sort of the transition vacuum, which is like for a lot of trans people before we transition, it's hard to have a sense of ever having a future. And if you don't have a sense of a future, it's really easy to sort of put all of your focus onto transition. And then when you feel like you've sort of completed the steps you plan to take, it can be kind of like, well, shit, what now? You can end up in this space where like, you're like, okay, I've done all of these things and now I suddenly have a future, but I don't have any plans. I don't know, what do I want my career to be? What do I want my life to look like? And that can be really disorienting, especially if it's compounded with the physiological effects of coming off of a surgery. So you're coming off of anesthesia, you might be coming off of pain medications. These are all things that can trigger depression, that can worsen mental health issues that are going on. So it's not uncommon for people sort of post-surgery to be in this place where they're overwhelmed by that whole experience. Another thing that I see, I like to call this like emotional jet lag, which is just like, there's this idea, my dad used to always say that jet lag was like your spirit not being able to catch up with your travel as quickly as like a plane or whatever it is. So when you get to this new place, you're disoriented for a while because your spirit is still like catching up to you. And I think about that with surgery. Like it's such a big change so quickly that it sort of takes a while for like your spirit or whatever to kind of adjust to it. It's kind of a whiplash. It's kind of a lot. And so that can be a really difficult thing. Another thing that can happen is that, maybe you sort of moved into transitioning really quickly before you had much exposure to the community, before you saw very many possibility models of different gendered ways of being. And as you have moved through your transition and become more involved in the community, you start to see other options that you didn't know were possible. And maybe you have a feeling of like, maybe not necessarily that you wish you hadn't done it, but like that you wish you'd maybe gone slower, done it a little bit differently, or explored different ways of transitioning. Again, there's a lot more here, but these are some of the things. The one more that I will say is about surgical complications. So coming out of surgery, if you're feeling dissatisfied with your outcomes or you're dealing with surgical complications like necrosis, loss of tissue, it can be really traumatizing. It can be really this experience that was supposed to help you sort of align and connect more with your body has created a scenario of dissonance with your body where looking at your body, experiencing your body is reminding you of the trauma of those post-surgical complications. And that is really, it's really, really difficult. And it's a thing that people don't, again, like talk about that much because there's such a fear that that will be twisted into a narrative of trans regret. I would love to take a second. I wasn't sure we were going to have time, so I forgot to say this before, but if there are other examples that you thought of as I was talking about this, if you want to add those into the Q&A, I would love to share some of those either now or at the end of the Q&A. Oh, we've got one already. Beautiful. Let me pull this up here. It looks like I can't actually access the Q&A, but I don't know if Beck, if you want to read what's coming up there.
Sure. This is coming from Vaughn, stating, "This is incredible content, incredible being in caps. Really wanting to emphasize for cisgender clinicians who might be hearing about these complexities for the first time, that it isn't helpful to discourage clients from taking steps towards transition in the midst of these complex emotions. Any advice for cisgender clinicians who are sitting with this complexity for the first time?"
Yeah, so that is exactly what I'm about to move into. So you were spot on. So let's do that. So we're going to talk about approaches to supporting trans and non-binary clients, because all of these things, again, can sort of reinforce that fear that you have, right? That like, oh my gosh, like all of these things could happen. So like, how do we prevent that? And how do we, help people through that? The first thing I want to talk about with that is normalizing these emotions. I don't know if Beck, if you can stop it from popping up more because it keeps coming down here. But yeah, so let's start with normalizing. I think one of the really important things is that in order to have any space for people to process these things, in order to have any space where people can feel safe enough, you have to be starting from a place of both being able to communicate and really believe yourself as a clinician that nothing this client is going to say is going to change how you see them, how you treat them, the pronouns that you use, how you respect their gender, and that it's not going to change your willingness to sign off on access to hormones or access to surgery. I think clients really need to know that that is true. Not just be told, but be shown that before there can be any space for people to process all of these difficult emotions. I think another part of this that's important is, all of those experiences that I gave examples of, these are normal experiences of any big change. And because it's so hard to talk publicly about them without them being misinterpreted, a lot of trans people can feel really alone in those experiences. So I think it's important from the baseline that you're able to normalize for people that, like, yes, it makes sense that this would bring up all of these things. It is a big, scary process that involves, making decisions to step into something where there's so much unknown, and it makes sense that there are so many complicated feelings that come up. And this next bit, I think it touches especially specifically on what Vaughn was asking about, hopefully, which is that like this exploring of these issues with your clients really, really needs to not be about you trying to figure out like, are you really trans? Do you really have dysphoria? Do you really want or need this? It needs to start from a place of asking permission. If you dive into asking questions and exploring these things, for a lot of people, it can feel like an attack. It can feel like, oh my God, I need to be on the defensive. I have to prove how trans I am. I have to prove that I deserve access to care. I have to prove that I'm certain. And I think there's a lot of value in being able to ask somebody for permission to explore those things, and to be open if that person wants to know why you want to explore that, to be able to talk about that. And exploring uncertainty, there's so many creative ways that you can do this. One of the things that I love to ask people is to think about if you lived in sort of an alternate universe where the laws of physics didn't apply, what would be your sort of ideal experience of transition, or your ideal body in terms of gender? Because it gets you into this creative mindset outside of the narratives that you've seen and the examples that you've seen. I think it's important for providers to have examples, to have possibility models, to have an awareness that transition is not a one-size-fits-all thing. It's not like you walk into the hospital, you go through surgery, you walk out the end. Transition is really a collection, a variety of different medical procedures and non-medical things and all of these things, and you get to pick and choose what works for you. I think one good example is that, like, even when it comes to surgery, um, you know, I, and these might be unfamiliar terms if you're not aware of the surgery terms, but I'm not going to go into too much detail on them. But one example is that if you're thinking about surgery, it is possible to have both a phalloplasty without having a vaginectomy, with being able to keep what is existing in your genital sort of arrangement currently. And that's the kind of thing that, like, not everybody knows. And so someone who is thinking about, do I want lower surgery or not, might not even have that in their list of options. So being able to have enough awareness to help people explore those things, I think, can be helpful. And also, this is a space where, as like, once you have that trust built up, that you can have conversations about people's beliefs about gender and sexuality, and gently challenge the ideas that are coming up for people around gender without that being about challenging their identity. Another part of this is just that, like, there are going to be a lot of complex emotions that come up. I'm realizing I'm running out of time, so if I talk kind of fast, that's what's going on. But that, like, it can be really hard sometimes, I think, to differentiate what the feelings are. So if you're feeling like, I just had surgery, I just had all these things, why do I feel so terrible now? Even if what that feeling really is grief and adjustment, it can get you to a place where you're like, is this doubt? Like, I don't feel like I doubt this or regret this, but, like, I feel bad. So, like, what is going on? Being able to untangle that and understand that is really important. Holding space for conflicting emotions. So, like I was talking about belief systems, right? Like, there are going to be things that people are not able to reconcile ever, or for a very long time. And I think it's important for people both to be able to learn how to tolerate that discomfort, which there are so many therapeutic approaches to, but to also know that, like, very few people who transition or who make any giant life decision are 100% certain when doing so. It is something that you can go back and forth on a pro and con list for years, hoping that you're gonna get to a place where you're like, I'm 100% sure. But I think it's important to understand that that's not necessarily realistic or even typical. There's more here, but I do want to make sure I get to the other slides, so I'll skip ahead here. The next thing I think is important to understand is, like, how you prepare people for these experiences. Making sure that people are aware of, like, risks around, like, post-surgical depression, trying to explore with people if they even have the capacity to kind of future planning after surgery, trying to create kind of a foundation or a safety net or something that they can build on afterwards, so that they don't feel quite so lost looking at their own future. And also just, kind of exploring realistic expectations, exploring how will people check in with themselves, in a month, in 2 months, when you've been on hormones. How will you know when it, like, if it feels right for you? How will you know if it doesn't? And also being aware of, like, the potential triggers that can come up, that, if you're working with folks with eating disorders, weight gain might come up. If you're, working with folks with trauma, there are triggers that might come up. And just creating some plans and some safety for how you're going to work together on those things. And the last bit of that is processing. So this is kind of the bigger, like, moving through things, emotional work, kind of coming back to that idea of, like, what does it mean to make a decision to transition when you're not 100% certain. I find it's really useful in this to utilize motivational interviewing and parts work to kind of talk about, one part of me really wants this and one part of me is kind of scared of it, to really encourage people to, like, build a relationship with their own gut and their own intuition. Because, again, you can make that pro-con list for years, And at the end of the day, like, it is going to be your gut that kind of has to make the decision for you whether you're going to take that leap of faith. Another part is understanding that, again, transition is not all or nothing. You can test the waters, you can start hormones and stop them later. And also understanding like how permanent or impermanent transition actually is. I think there are a lot of misconceptions about this. Um, as an example, there are a lot of trans women who look like me or who start transition looking like me, who then physically transition and move through the world being read as women. If that can be true for a trans woman, that can also be true for me if in 10 years I change my mind or I realize that this isn't the right fit for me. I can have electrolysis. I can get vocal training. I can have breast augmentation. All of these things are still a possibility. And I think that the way that we think of transition as irreversible just doesn't actually really line up with reality if you're looking at the experiences of trans people who, you know, have changed our bodies drastically in some cases. Another part to think about is how to help folks who are trying to cope with not transitioning, but who are maybe still experiencing dysphoria, who don't want to transition or don't have access to transition or aren't ready for transitioning. One thing that I see being helpful for folks sometimes is using other forms of body modification. So that might be things like garments, like having binders or padding. But it can also be things like piercing and tattoos. I know folks who have gotten genital piercings or piercings on their chest that modify both like the visual of that part of their body and modify their relationship to it because it has a new sensation, it has a new look, it creates a different relationship with this body part that's really hard to live with. And I think also like seeking experiences of what we call like gender euphoria, which would be those moments where you feel really seen in your gender. That can happen without transitioning, and that, you know, it's not all just about avoiding dysphoria. It's also about like pursuing where are the relationships or the scenarios where you really really get to experience that euphoria, and how can you bring more of that into your life. And the last two things here, one is just that there's going to potentially be trauma work that needs to be done. There might be new triggers that are coming up. There might be new experiences of trauma from being out in the world as a trans person. And experiences of trauma that happen before you transition don't just magically go away. They can linger afterwards. So all of that work might need to be done. And the last bit is grief work. I think grief is a really touchy word in our community because a lot of times families will describe their child transitioning as a death and will describe themselves as grieving their child's death in a moment where that child feels like themselves for the first time. And that can be a really, really painful, harmful thing for a kid to hear. What I'm talking about here is just the general grief that comes with any kind of big change or loss that trans folks as ourselves experience around these changes. And I think it's important for us to have places where we are able to have rituals and processes that help us move through that grief, and to make sure that those things are, you know, individualized to that person, that person's culture, that person's experience. One of the things I think about a lot is like the question of like, what did this body survive with you? What did this body carry you through? Any change in that body that you survived trauma in, that you survived your life in, can be really intense and powerful. And I think it's important for there to be room for people to honor that and to let go of it. And that's what I kind of think of when I think about the grief work, especially in this. So just to kind of summarize some of what we talked about today, the first thing I think is important to take away is that when we cling on to our fear of regret, we are actually creating the scenario where regret could potentially happen because we are taking up all the room with our fear and making no room for other people to process their own fears and uncertainties and all of these things. And that if you are trying to support trans clients through these processes, you have to be genuinely coming from a place that there is nothing that they're going to say that's going to change the way that you treat them, the access that you provide them, if you have to be a gatekeeper to surgery or hormones, and that you are asking their permission to go to these places of exploring these things. Some people may not want to go to any of those places, and that is their choice. And it's not your place as a clinician to dig into that if that's not where they want to go. But if they do give you that permission and you do have that trusting relationship, I think there is a lot of support that can happen in that. So yeah, that was a lot of things I just threw at you. I can see the Q&A popping up. And so I do want to leave, I think we have about, a good like 10, 12 minutes for questions, which is great. I didn't think we were gonna have that much time. So I would love to just open that up to that and, answer some of what is coming up there.
Great. Thank you so much, Miles. That was awesome. Yeah, questions are rolling in, so please feel free to put them in the Q&A. I'll just start with the first question. Justin asks, can you clarify the definition of gatekeeping?
So gatekeeping is what we refer to as the process in which clinicians, healthcare providers are in control of whether or not you access surgery, hormones, all those sorts of things. So like to kind of give you an example, like if I wanted to go get a face tattoo right now, I could just go do that. There's no gatekeeping between me and that thing. But if I wanted to go have surgery right now, a transition related surgery, I might, depending on where I am and what my state is and stuff, I might have to get a letter from a therapist. I might have to, in the past it was that you might have to sort of live as this gender for a period of time. So it's these efforts that it's sort of the opposite of what we call informed consent model, which the informed consent model is essentially that, you are the one who makes those decisions directly about your body.
Awesome. Christina asks, as we want to help the client that comes to our treatment, and how can we support the family? Any ideas, any programs? I've referred some parents to do their own therapy. However, what else is there?
That is its own workshop. It's a great question. One of the things I think about a lot in terms of that work is that, sort of like what I was talking about the sort of grieving the child and the way that impacts the child. There's this theory, I can never remember the name of it off the top of my head, but it was formed around thinking about people who are living with cancer and their families around them. And the idea is that like the person who is experiencing this thing, the cancer or like being a trans person, not that those are the same thing at all, but like the person who's going on this intense journey is at the center of these concentric circles. And as you go out, it's like, the immediate family, people who are further out, people who are further out. And I think it's really important that everybody who is at one ring of the circle is getting their support mainly from the people at the next ring out. So you're not going back in and piling on to that person who's at the center of this, that I need to process with you all the feelings that I have to make sure that they are going out. I don't off the top of my head have more specific resources than what you're talking about. It sounds like you're kind of sending them in the right direction to get that therapy. I mean, hopefully, there are people, like I work with families. There, if you can find folks who are gender therapists who do work with families, that's kind of the ideal scenario. But yeah, I don't have specific resources off the top of my head about that.
Yeah, and I will say, like, I mean, just a little bit of a resource that I've had over the years is there's a lot of PFLAG, especially online right now. That's not necessarily the therapeutic work, but it's the support. And sometimes parents need to hear that from other parents. And just, just to say that I also run a parent group every Monday that's free. So Christina can reach out, which is a conversation that is a consistent conversation. So, and I bring in other therapists to come in and have conversations with these parents as well. So just a little plug there.
Yeah.
Ernest asks, How does an LPC qualify to work with this population? Many areas require additional training and education. Is this one of those areas? I have been led to believe that I need 3 years experience with a supervisor before I can work in this field.
In this field, specifically working with trans folks? It's a good question. I mean, the answer is there's not one answer. I mean, personally, you know, I'm coming at this as someone who has been in this community for 15 years, and not as a clinician, but just as a trans person. And there are still things that I don't know. There are still surprises that come up for me. There are still things that I might feel a certain way about and another trans person might feel a different way about. So I do think that it's important that like as much, you know, support as you can get is really important, especially before you're at a place where you're like advertising to work with these clients, because a lot of us have had the experience of going to providers who are like, yeah, I don't know, I'm trans affirming, I'm fine with trans people, but who don't understand kind of these deeper nuances. I also understand though that like depending on where you're working, I mean, if you're in an agency and you're just getting whatever clients are coming to you, you might not have the option to refer out to a more qualified professional. And in that case, I think, you know, consuming as much as you can of resources like this that are by trans people is a really important part of that. Finding supervision, if you can, is really important. So I do think, you know, like as much external feedback as you can get and as much training as you can get, the better. And also there's not like a one size fits all sort of rule, I guess, of what that looks like, in my opinion.
Melissa says and asks, I work in schools with special ed and have a few students who identify as a gender that is not on their IEP or legal name, and it's very triggering. One student is on the autism spectrum, and parents, staff don't take the student seriously when saying, I'm supposed to be a boy. It's a very difficult thing to navigate as a school therapist, as it does impact their social relationships and school functioning. I have made sure that they started receiving outside therapy because it's too much for me to handle in the school setting. But even in an IEP meeting, it causes issues that, in my opinion, cause little traumas throughout the system. I mean, and I guess maybe there's no question there, but maybe experiences with kids on the spectrum, like, or other mental health issues maybe that they could be struggling, or neurodiverse kids.
Yeah, I mean, I think one of the things that happens so often, and Beck and I were actually sort of talking about this beforehand, is that it's really easy for people to feel like the only person who you can trust really knows that they're trans is someone who doesn't have any mental health issues, who doesn't have any neurodivergence, who doesn't have any eating disorders or addiction, any of these things. And it's just not realistic, because there are lots of people in general and trans people who fit in all of those categories. I think part of what, you know, I'm hearing in your statement or question is like that there is just this systemic level of like, it's not just what happens between you and this person in the therapy room. It's also like, you know, are you able to successfully advocate for people who are talking about the EEP or the IEP to at least use the right name and pronouns? Are you able to have those conversations with people? And it's difficult in the school settings. I mean, one of the things I know, I've gone into schools and done trainings, and I know that like when you're able to bring in people from the outside, sometimes the conversation can be a little more neutral than whatever the tension might be within the school between people who work there and are dealing with the politics of all of the things. But yeah, I'm not sure that I have an answer, because I'm not sure what the question exactly was, but you're definitely not alone in that experience. And it is, you know, it's really great that you referred out, and it is really important that that advocacy is happening in that space, because there's only so much that we can do in the room as therapists versus, you know, the whole world that these people are living in that's affecting them every day.
Yeah, I think you're correct. The systems, to change the systems is so much harder, around insurance, around treatment, around all of these school systems that are so antiquated in their language, where trans people were never brought to the table. Like that conversation was never you know, broached, and now it is, and everyone's like, I don't want to change anything. If we change anything, the whole system's going to fall down, which might be a good thing. You never know. So Karen asked, suggestions for talking with a parent of a trans teen about the myth of trans regret.
It's a great question. I think that part of what I started to go into but didn't want to take too much time to go into is there's some amount of what is helpful is showing that, like, just literally, like, let's look at the research together. Let's look at the fact that this is not this big phenomenon. But I don't think that that's enough to quell people's fears. I think if that is where your fear is, you kind of have to meet people at that and walk through, okay, what is the worst case scenario? Like, if that were to happen, is that actually as scary as you think it is? Is it actually as irreversible as you think that it is? Because I think when we break it down, sort of like I talked about, that like it's not necessarily as irreversible as people feel like it is, and it's not necessarily a situation of suffering. So I think you have to gauge where the parent is at with that, but I think that it is important to be able to, like, empathize with and acknowledge and walk through what their fear is, while also being able to show them that, like, that fear is maybe not actually grounded in reality or research or statistics or any of those things. Yeah, I could go into that a lot more. There's so much there. These are really great questions.
That's a whole nother.
There's so many popping up, and so I want to make sure I do get to them. But yeah, these are great questions. Sure.
Yeah. Andrew asks, as mental health professionals that belong to the LGBTQIA community, do you think it's important that we list that, you know, I'm a queer therapist, gay therapist, trans therapist on our website, etc.?
It's a great question also. Personally, yeah. I think that therapy is so much about the relationship. Like, you can have a million different kinds of therapeutic approaches, but the fundamental thing that is most important is that relationship. And for a lot of marginalized people, knowing whether this person might in some way share that experience can make a big difference in how comfortable they feel. And I personally like being open about that. I'm able to be now in the practice that I am, because I know that it means that people can make that decision for themselves. If they are like, I really want someone who I can at least sort of project onto a belief that they might have shared this experience. I don't think anybody should be required to put those things out there if they don't want to. But I think that if you're trying to speak to trans people who are used to being in rooms with therapists and healthcare providers who have no lived experience, no understanding of their culture, their community, that valuing that lived experience is important. I think, you know, my lived experience probably influences this presentation and my work more than my clinical education did. So I think it's a valuable thing to include, just like you would include kind of other credentials, but it's very much a personal choice.
Yeah. We do still have time for more questions, so feel free to put them in the Q&A. Here's another question. I have a young man who's incredibly immature. He has approached his mother to begin treatments, I'm assuming hormone treatments. Mom is concerned that he's too young to make this decision. What are your thoughts about age-wise? Yeah. Is there an age, I guess?
Yeah. Or, no, sorry, go ahead.
Oh, I said, or maturity level, maybe? I don't know.
Yeah, I think it's a really hard question. I think you're hitting on sort of like where this gets like tricky, where the rub is, right? And I still think that like part of what stands and is important is understanding, again, that like the potential impermanence of a lot of these changes, that like this doesn't necessarily mean that if that is not the choice that he would make longer term, that now his like life is ruined because of that. But instead understanding that that might be part of his gender journey. But I think part of what, you know, you can explore with people is like, just exploring that maturity, exploring like what, because I think sort of more than emotional maturity is just wanting to make sure that people have a mature understanding of gender, of the possibilities, of the options, understanding that like masculinity isn't the thing that makes you a trans man and femininity isn't the thing that makes you a trans woman. So yeah, I'm not sure if I'm fully answering your question, but I think that it can feel like a sort of scarier, bigger decision, I guess, in some ways than it really functionally is. And I think it also sort of depends on what that person's age is, because the reality is that for most youth, what's happening is hormone blockers, which are extremely reversible, or maybe starting hormones. So it's not like most youth are sort of like running out and getting surgery right away. So that impermanence is even more significant for that age group. Yeah.
Yeah, and I think parents are so afraid because they maybe have just found out, and you have to also look at the young person and ask them, how long have you known? Because they could have been holding on to this for however long. So it seems very fast, but for the teen, it's like, or the young person, it's like, I've been holding on to this for 5 years, a year, even a year, is a long time. And to hold on to that secret, or that
my
part of
parents
themselves.
were shocked when I told them I was
Right.
physically transitioning, even though I'd been struggling with it internally for like 7-8 years at that point.
Right.
So yeah.
Right. Well, I really appreciate you kind of diving into this idea of like exploring all of the nuances, because I think people go online, like trans folks go online because it's the most accessible and easy, and they get all of this information, and it's all jumbled up, and so they come in knowing, but maybe not even like being able to explore, like, what do they want for themselves, right? What are the expectations that they have for themselves, and being realistic around those things, and also not just in like grief, but also in celebration, right? So there's the pain of it all, and then also the celebration of it as well.
Yeah. Well, and I think that's like my biggest hope with this workshop, is that it leaves people rippling out, having conversation in a way that just makes room for us as trans people in therapy and elsewhere in the world to have a range of emotional experiences and expressions around our transitions that don't necessarily reflect on our preparedness for transition or the legitimacy of our transition, that just like anybody else having a big experience in their life, that there can be this range of emotions. And I just want there to be space for that. That's really why I'm doing this.
Yeah. Awesome. Thank you so much. I really appreciate you. We just have a whole lot of like thank yous, great information, you're wonderful, and people can get a hold of you this way. They can get your they can get the slides.
You can email me, miles@prospecttherapy.com, and that's my Instagram and website's there as well.
Yeah, and follow Miles on Instagram. It's awesome. Always really great quotes and stuff. So I really appreciate you and everything that you're doing, and hope to see you in person soon.
Yes.
Yeah. Okay.
Not too soon, but yeah.
Not too soon, but
thank you all so much.
Everyone.
Thank you, Beck. And thank you everyone for being here. I'm really, really grateful.
Stay safe, everyone. Take care.
Thank you.